Most of us grow up believing that regular doctor visits and yearly tests are the best way to stay healthy, especially once we cross 65. The logic seems simple. The more you check, the safer you'll be. But what if I told you that some of those routine tests may actually waste your time, drain your savings, and in certain cases even harm your health? That may sound surprising, even uncomfortable, but more and more doctors are recognizing that blanket testing for seniors doesn't always deliver the benefits people expect. In fact, it can sometimes create the opposite: false alarms, unnecessary anxiety, and medical procedures that end up lowering your quality of life instead of protecting it. As we age, our bodies change. The same tests that made sense in our 40s and 50s may not carry the same value or the same safety when we're over 65. This video is not about ignoring your health. It's about understanding which routine checkups truly matter and which ones might be costing you more than they're worth. So stay with us as we uncover the tests that seniors often don't need, why they persist, and how you can make smarter choices for a healthier future. Test number 1. Annual full-body scans. CT or MRI peace of mind. Packages. In today's world, health marketing has become almost as persuasive as any commercial product. Hospitals and diagnostic centers often advertise peace of mind packages. Full-body CT or MRI scans that promise to uncover hidden diseases before they cause symptoms. For seniors especially, the idea feels reassuring. After all, who wouldn't want to know if there's something lurking beneath the surface? At first glance, the pitch makes sense. Scan your body once a year, catch problems early, and stay ahead of serious illness. But the reality behind these full-body scans is far more complicated and often more harmful than helpful. The hidden risks. The biggest issue with routine full-body scans is the flood of false positives and incidental findings. These are minor abnormalities, like small cysts, scar tissue, or tiny nodules, that are incredibly common in older adults but rarely dangerous. When a scan picks them up, however, doctors can't always ignore them. Instead, these harmless findings often lead to cascades of further testing: follow-up imaging, biopsies, even surgery. Radiation exposure is another concern. A CT scan delivers far more radiation than a standard X-ray, and repeated annual scans can gradually increase the risk of cancer over time. MRIs avoid radiation but are still expensive, time-consuming, and prone to detecting harmless issues that create unnecessary alarm. Consider the case of a 72-year-old man who purchased a peace of mind CT package. His scan showed a small growth on his kidney, something his doctor felt needed to be ruled out for cancer. After a series of additional tests, he underwent surgery to remove part of the kidney. The pathology later revealed the growth was completely benign and would never have caused him harm. The surgery left him with complications, including long-term fatigue and reduced kidney function, all from a procedure triggered by a test he didn't really need. Stories like this are not rare. They highlight a fundamental problem. When you look hard enough inside the human body, especially as it ages, you will always find something. But not every something deserves treatment. Emotional and financial costs. Beyond medical risks, there's the emotional toll. Many seniors who undergo full-body scans end up waiting weeks for follow-up results, caught in a cycle of anxiety over whether they might have cancer or another life-threatening disease. Even when results turn out benign, the stress takes a real toll on mental health. Financially, these packages can cost thousands of dollars. And because most insurance companies don't cover them, seniors are left paying out of pocket. Worse, the initial cost is only the beginning. Every suspicious finding can generate more bills for labs, specialists, and treatments. The smarter alternative. So what's the better approach? Instead of broad, untargeted full-body scans, doctors recommend targeted imaging based on symptoms or real risk factors. For example, if you develop unexplained headaches, an MRI of the brain makes sense. If you're experiencing chest pain, a focused cardiac scan is reasonable. But ordering a scan of your entire body without symptoms is like fishing in an endless ocean. You're almost guaranteed to catch something, but not necessarily something dangerous. Routine preventive care should focus on proven screenings like blood pressure checks, diabetes monitoring, and evidence-based cancer screenings, not blanket imaging. Annual full-body CT and MRI peace of mind scans might sound reassuring, but for seniors they're often a trap. Instead of providing clarity, they generate fear, unnecessary procedures, and real health risks. While medicine should absolutely be proactive, it must also be smart, targeted, and evidence-based. If you're over 65 and your doctor suggests a full-body scan without specific symptoms, pause and ask, what am I really looking for? What's the proven benefit? In most cases, true peace of mind comes not from more testing, but from making careful, informed choices about which tests truly serve your health. Test number 2, colonoscopy. After 70, without symptoms or family history. For years, colonoscopy has been hailed as the gold standard for preventing colon cancer. And it's true. When done at the right time, colonoscopies can save lives by detecting polyps before they turn cancerous. But once seniors reach their 70s, especially those without symptoms or a family history of colorectal cancer, the balance of risks and benefits begins to shift. Medical guidelines, including those from the U.S. Preventive Services Task Force, USPSTF, now recommend against routine colonoscopies after age 75 for people at average risk. Why? Because the likelihood of developing a new aggressive colon cancer at this stage is relatively low, while the risks of the procedure itself become higher with age. The risks. Seniors face colonoscopy is not a simple test. Preparation requires drinking large amounts of laxatives to clear the bowels, a process that can lead to dehydration, dizziness, or dangerous electrolyte imbalances in older adults. On the day of the procedure, sedation carries its own risks, including confusion, low blood pressure, and lingering drowsiness that can increase fall risk. The procedure itself also has potential complications. Though rare, perforation of the colon wall can occur, especially in older adults with more fragile tissue. Even minor complications such as bleeding or infections become harder for seniors to recover from compared to younger patients. Take the case of Margaret, a 74-year-old who underwent a routine colonoscopy despite having no symptoms or family history of colon cancer. During the test, her colon wall was accidentally perforated. She was rushed into emergency surgery, which left her with a colostomy bag for several months. After all the stress, Margaret learned that her colon was completely healthy. She had endured a life-altering complication from a procedure she never actually needed. Her story reflects a growing concern in medicine. When procedures designed to prevent illness cause more harm than the disease they're meant to catch, we need to reconsider the wisdom of using them routinely. Alternatives to consider. Fortunately, colonoscopy isn't the only way to check for colorectal cancer. Non-invasive stool tests, such as the fecal immunochemical test, FIT, or the newer multi-target stool, DNA test, like Cologuard, can screen for signs of cancer without the risks of sedation or invasive procedures. These tests are safe, convenient, and effective for seniors who want reassurance without putting themselves through a colonoscopy. If a stool test does raise concern, then a colonoscopy can be performed as a follow-up, meaning the invasive procedure is used only when it's truly necessary. This approach drastically reduces the number of seniors exposed to potential complications. Symptom-based screening. For seniors over 70, the smarter path is often symptom-driven screening. If you develop new bowel changes, such as blood in the stool, unexplained weight loss, or persistent abdominal pain, that's the time to discuss colonoscopy with your doctor. But absent these warning signs, a just-to-be-safe colonoscopy may actually place you in greater danger. Colonoscopy is a powerful tool, but like any medical procedure, its value depends on timing, risk, and individual health status. After 70, especially in the absence of symptoms or family history, the risks often outweigh the benefits. Seniors should think twice before agreeing to routine colonoscopy and instead explore safer, less invasive alternatives. The key takeaway is this: good medicine is not about doing every test available. It's about choosing the right test for the right person at the right time. For many seniors, that means stepping back from automatic colonoscopies and focusing on smarter, more balanced approaches to prevention. Test number 3. Cardiac stress tests for asymptomatic seniors. The heart is often the biggest health concern as we age. It's no wonder seniors worry about heart attacks and cardiovascular disease more than almost any other condition. For this reason, many doctors, and sometimes patients themselves, order cardiac stress tests as a precaution, even when no symptoms are present. The idea is simple. Put the heart under controlled stress, on a treadmill or with medication. Take images or EKG readings and spot hidden blockages before they cause trouble. On paper, it sounds like a smart safety net. But in practice, for seniors without symptoms, these tests often do more harm than good. The problem with false positives. The older we get, the more likely the test is to pick up harmless irregularities, minor changes in heart rhythm, borderline blood flow patterns, or small anatomical quirks that have no real impact on health. These false positives are incredibly common in seniors and can easily be mistaken for dangerous heart disease. Once flagged, these abnormal results frequently lead to invasive follow-up procedures. The most common is the angiogram, where dye is injected into the arteries to look for blockages. While angiograms are generally safe, they carry risks of bleeding, infection, kidney damage, and stroke, risks that grow with age. The cascade of unnecessary procedures. Worse still, stress test false positives often push patients into stents or even bypass surgery, even when the original concern wasn't life-threatening. Modern cardiology research has shown that stents and bypass surgery rarely prevent heart attacks in patients without symptoms. Instead, lifestyle changes and medication are usually far more effective at reducing risk. Yet once the disease label is attached, seniors can find themselves caught in a whirlwind of procedures they didn't need. A real-life story. George, a 76-year-old retiree with no chest pain or shortness of breath. During a routine checkup, his doctor recommended a stress test just to be safe. The results looked abnormal, leading to an angiogram. During the procedure, a minor blockage was found and a stent was placed. What followed was a month-long hospital ordeal when George developed complications from the stent placement, including an infection that weakened his recovery. The irony? That blockage would likely never have caused him a problem in his lifetime. George went from living independently to struggling with medical complications, all because of a test he didn't need. Emotional and financial. Toll beyond the physical risks, stress tests can trigger overwhelming anxiety. Being told you might have heart disease, even if later proven false, can weigh heavily on mental well-being. Add in the financial impact of angiograms, stents, or cardiac rehab programs, and it's easy to see how a single unnecessary test can spiral into a massive burden. Smarter alternatives. For seniors without symptoms, the best preventive approach is not blanket stress testing. It's lifestyle monitoring and targeted evaluation. Regular blood pressure checks, cholesterol management, staying physically active, eating heart-healthy foods, and avoiding smoking are far more effective ways to reduce cardiovascular risk. If symptoms like chest pain, shortness of breath, or fainting occur, that's when a stress test may be appropriate. Doctors also recommend non-invasive risk assessments such as coronary calcium scoring or advanced blood tests in some cases. But again, these should be symptom or risk-driven, not performed on every senior just for reassurance. Cardiac stress tests can be life-saving when used for the right patients, those with real symptoms suggestive of heart disease. But for healthy, asymptomatic seniors, they're far more likely to generate false alarms, trigger unnecessary procedures, and reduce quality of life. Instead of chasing problems that may not exist, seniors are better served by focusing on proven lifestyle strategies and only testing when symptoms or risk factors make it necessary. After all, prevention isn't about doing the most. It's about doing what truly matters. Test number 4. PSA testing for prostate cancer, men over 70. Prostate cancer is one of the most common cancers in men, and for decades the PSA blood test, prostate-specific antigen, has been promoted as a simple, effective way to catch it early. A quick blood draw, a number on a chart, and the reassurance, or alarm, that comes with it. On the surface, it feels like the responsible thing to do, especially as men age. But once men pass 70, the usefulness of routine PSA screening becomes far more questionable. The problem with PSA screening. The PSA test isn't a perfect indicator of cancer. Levels can rise for many harmless reasons: age-related prostate enlargement, infections, or even recent sexual activity. This means false positives are common, leading to a chain of follow-up biopsies and treatments that often turn out to be unnecessary. Even when prostate cancer is truly present, most cases in older men grow so slowly that they never become life-threatening. Studies show that many men over 70 will die with prostate cancer, not from it. Yet once detected, the word cancer often triggers aggressive treatment, regardless of whether it's truly necessary. Risks of unnecessary treatment. When PSA testing leads to biopsies, men face risks like bleeding, infections, and urinary complications. If cancer is confirmed, surgery or radiation may be recommended. While these treatments can sometimes be life-saving, in many older men they offer little to no benefit and carry life-altering side effects. Incontinence, erectile dysfunction, and chronic pain are among the most common long-term consequences of unnecessary prostate cancer treatment. For seniors who may never have experienced symptoms from their cancer, these side effects can dramatically reduce quality of life. For example, the case of Henry, a 74-year-old who felt perfectly healthy. A routine PSA test showed an elevated level, and his doctor urged a biopsy. The biopsy revealed a small, slow-growing cancer that likely would never have caused him harm. But the diagnosis frightened him, and he opted for prostate surgery. After the operation, Henry was left with permanent incontinence and erectile dysfunction. He traded a life without symptoms for daily struggles, all because of a test that experts now agree he never truly needed. The expert consensus medical organizations, including the U.S. Preventive Services Task Force, recommend against routine PSA screening in men over 70. The risks of overdiagnosis and overtreatment outweigh the potential benefits in this age group. Instead, PSA testing should be considered only in younger men with higher risk factors, such as a family history of prostate cancer or certain genetic predispositions. Smarter alternatives. For men over 70, the best approach is shared decision-making. Instead of automatically ordering a PSA test, doctors should have an open conversation with patients about their personal risk, their overall health, and their preferences. In many cases, watchful waiting or active surveillance is the most appropriate choice. This means monitoring symptoms and health changes without rushing into invasive tests or treatments. Men who do experience concerning symptoms, like difficulty urinating, blood in the urine, or pelvic pain, should absolutely seek medical evaluation. But for otherwise healthy seniors without symptoms, skipping routine PSA screening is often the safer, wiser choice. The PSA test may look like a simple, harmless blood draw, but for men over 70, it can open the door to unnecessary biopsies, risky treatments, and life-changing side effects. The truth is that most prostate cancers in seniors are slow-growing and unlikely to cause serious problems. Instead of focusing on blanket PSA testing, older men are better served by monitoring their health, staying alert to symptoms, and having honest conversations with their doctors. In many cases, the best treatment for prostate cancer in older men is no treatment at all, just careful, informed observation. Test number 5. Mammograms. Beyond 75, women without high risk. Breast cancer awareness campaigns have been incredibly successful over the years. Pink ribbons, fundraising walks, and countless advertisements remind women that early detection saves lives. For many, the mammogram has become a symbol of responsibility and self-care. Women over 75 often continue to schedule them out of habit, or because they believe skipping one is risky. After all, why stop checking for something so serious? But here's what many don't realize. The benefits of routine mammograms decline significantly after 75, while the risks of false alarms, unnecessary procedures, and emotional distress increase. The reality of screening. Past 75. Most large-scale studies show that mammograms save the most lives in women aged 50 to 69. Beyond 75, the numbers change. The odds of detecting a life-threatening breast cancer drop, while the odds of finding harmless abnormalities rise. Many small lumps or calcifications found in older women would never have grown large enough to cause symptoms or shorten life expectancy. Yet once something is detected, the medical system usually responds with more testing, biopsies, ultrasounds, MRIs, and sometimes even surgery. This cascade can cause more harm than good, especially in older women whose bodies recover more slowly. The risks: more than just discomfort. Mammograms are not harmless. Aside from the physical discomfort of the procedure, the bigger risk lies in overdiagnosis. An abnormal result can trigger a chain reaction of invasive follow-ups. Biopsies may cause pain, bleeding, or infection. Surgery or radiation may leave lasting fatigue and complications, sometimes for a cancer that never would have been dangerous in the first place. There's also the emotional toll. A false alarm can cause weeks of anxiety, sleepless nights, and fear that lingers even after a benign result. For women at this stage of life, peace of mind and quality of living are just as important as longevity. A story that stands out. Consider Margaret, a 77-year-old grandmother who had been diligent with her mammograms for decades. She had no symptoms and no family history of breast cancer, but during her annual scan, doctors found a tiny abnormality. A biopsy was performed, followed by surgery to remove a small lump. Months of follow-up appointments, scans, and worry followed. Later, her oncologist admitted the cancer was so slow-growing that it likely would never have affected her health. Margaret spent nearly a year consumed by treatments and stress, all for something that posed no real danger. What the experts say. Organizations like the American Cancer Society and the U.S. Preventive Services Task Force now highlight the lack of evidence supporting routine mammograms in women over 75. They point out that life expectancy, overall health, and individual risk factors matter far more than age alone. In fact, many oncologists stress that the potential harms of screening may outweigh the benefits once women reach their late 70s, particularly if they have no symptoms and no elevated risk. Smarter alternatives. Instead of routine mammograms, women over 75 are encouraged to practice symptom awareness. That means paying attention to changes in the breast, such as lumps that can be felt, skin changes, or nipple discharge, and reporting them promptly to a doctor. For women with a strong family history of breast cancer or genetic risks, screening may still make sense after 75, but it should be carefully discussed with a healthcare provider. For everyone else, the focus should shift from routine scanning to overall well-being, maintaining a healthy diet, staying physically active, and managing other chronic conditions that have a bigger impact on longevity and quality of life. Routine mammograms past age 75 often give the illusion of safety while introducing new risks, false positives, unnecessary biopsies, and life-disrupting treatments. The truth is, many of the cancers detected in this age group grow so slowly they never would have posed a threat. Women deserve to know that skipping a mammogram after 75 is not neglect. It can actually be a wise, self-protective choice. Prioritizing comfort, independence, and emotional peace is often more valuable than chasing tests that no longer provide meaningful benefits. Smarter healthcare, not more healthcare. Reaching 65 and beyond is a milestone that deserves celebration, not constant fear about what might be lurking in your body. But our healthcare system often pushes a more is better mindset. More scans, more tests, more procedures. The truth is, unnecessary screenings can create more harm than good. False alarms, overdiagnosis, and the risks of invasive follow-up treatments can rob seniors of peace of mind, health, and financial security. This doesn't mean ignoring your doctor or refusing medical care. It means shifting to a smarter approach, one that prioritizes quality over quantity. Instead of blindly signing up for every test on the menu, seniors should focus on symptom-driven evaluations, preventive strategies that actually work, and regular conversations with trusted physicians about what truly matters for their unique health journey. Healthcare should empower you, not overwhelm you. After 65, the best medicine often isn't about chasing problems that might never exist. It's about staying active, eating well, managing chronic conditions, and recognizing when a test is truly needed. That's how you protect both your health and your peace of mind.